Hello everybody, I'm Sophie and I am the Alumni Mentoring Coordinator at King's. Welcome to the very first video from the mentoring video series by the Florence Nightingale Mentoring Programme. We are so excited. Welcome to the very first video. We are so excited to be introducing a fantastic lineup of King's professional nursing and midwifery alumni to you all. Our mentors have years of experience and expertise, and they are looking to share this with King's students and recent graduates. Now, this video is just a taste of the wealth of knowledge and insights from King's alumni, because we are offering you, King's students and recent graduates, the opportunity to speak to any of our speakers today or find a mentor to help you during your studies or as you begin your career as a nurse or midwife. All you need to do is register onto King's Connect, the King's mentoring platform, to search for a mentor. The link is in the video description below, so don't delay and try it today. And if you're King's alumni with bags of experience in the nursing and midwifery field, why not sign up as a mentor and support a student or recent graduate? You can do this again by registering on King's Connect. Now, without further ado, I'd like to introduce you to our first speaker, David Bendell. Over to you, David.
Hi everyone, I'm David. Following the completion of my KCL degree in 2011, there have been a number of exciting opportunities where I have been able to pitch in and gain valuable experience in the US. My master's degree, undertaken at the University of Pennsylvania, entitled Nursing and Healthcare Administration, allowed me to develop administrative skills pertaining to the healthcare profession, with patient care being of utmost importance. My nursing degree at KCL gave me a great foundation. Practical nursing skills are a terrific bonus in the admin arena and cannot be underrated. After Penn, I worked as a registered nurse for 2 years with a very skilled team on a uniquely combined ENT, plastics and nephrology ward at a center of excellence called the Cleveland Clinic. I gained extremely valuable experience working alongside those professionals. I moved back to Philly to become an administrative fellow, then Associate Director of Operations in the Penn Medicine Cancer Center. This was invaluable experience of how admin operates within a clinical setting. In November 16, I founded a healthcare computer vision company, which is all thanks to a couple of master's level options giving me a foundation in computery stuff. I'm going to talk about 3 interdependent skills that form part of my tool belt that I think are really important for registered midwives and nurses starting out in the workplace. As a professional, your clinical knowledge is going to serve you well wherever you go in your healthcare career. And as you're starting out, it's so important to remember that your studies don't end when you graduate from King's College London. Rather, you're stepping into the next phase of learning. In an evidence-based care world, your knowledge is a valuable asset. I feel like the pressures on you as current or recently graduated students in terms of providing value care to NHS patients are so much greater than when I was a student in London 7 years ago. Sure, I wanted to graduate knowing that I could deliver the best possible care to my patients, but there was considerably less scrutiny on outcomes and quality measures back then. We are knowledge workers. So we have to stay abreast of knowledge development in our areas of interest, in our clinical specialties, American specialities, and in the facets of care that personally interest us too. When you're in the front lines of care, at the bedside, going into homes, working in outpatient facilities, and getting your feet grounded in your clinical career as a midwife or nurse with a license to practice, you need to deliver valuable care. To me, value care is defined as outcomes that matter to patients over the cost of delivering those outcomes. The factor in that equation that you can influence the most is outcomes that matter to patients. And here are a few ways I do that. I subscribe to a healthcare e-journal, which is cheaper than a traditional print journal. And I make a point of reading a couple of interesting looking research-based papers each month on interesting and diverse ranging topics. You have access to a lot of experts in your work environment, so validate your understanding so that you're clear on what you're learning and applying to practice. I ask my peers, usually the ones more experienced than me, if they have read anything interesting recently in whatever speciality I'm working in at the time. They are happy to share literature with me, so I too can learn what they have learned. This also gives you someone you can talk to about the literature if you have any questions. I found this method really useful when getting started as a new to practice nurse here in the USA, and I still do it today. I'm also still in touch with most of those nurses because through learning together, we would share our experiences, get to know each other personally, and forge a meaningful connection together. We learn a lot through hands-on experience, so I'll always volunteer to learn new clinical skills, to become a champion of a technique, and to be the teacher to my colleagues. I really love the concept of training the trainer and passing on new knowledge. So take a risk, raise your hand, and step out to gain the knowledge and experience you need, because that really helps you to make a difference to what you and ultimately to your patients. Honestly, I wouldn't try to do more than this. We're all extremely busy with a lot coming at us from all areas of our lives. But this is a commitment you have to make. You have to stay in touch with how things are evolving and constantly hone your knowledge. My next skill is communication. You can never under-communicate. It's really important to capitalize on every opportunity you have to communicate and constantly bringing people back to the central ideas of delivering high quality, accessible and cost-effective patient care. You have to communicate in a way that people understand, but communication is very complicated. You can think you're communicating with people, but we know lots of times that people don't hear what we think we said to them. So speaking to people in a language they understand will help you to advance your work faster, increasing its potential impact. You have to be very mindful and deliberate about that. A framework I use all the time to deal with different people, particularly my colleagues, is to think about what their working styles are so that you can communicate with them in a way that will resonate with them and will ultimately enable you to get done what you need to get done. If you'd like to hear more about that from me, then comment below and I'll set something up with you. I think focusing on the intangibles, the softer skills, can really help to get you through the steep learning curve of being a new midwife or nurse. Remember, people don't know what you're thinking unless you talk. So talking about things is very important. A great place to start with brand new colleagues, such as an on-call doctor in patient care, is to introduce yourself with your full name and then giving a concise picture of your patient's status by using a tool such as SBAR for the situation, background assessment and recommendations for next steps in the care pathway. Lastly, it's a great morale booster to share compliments from patients and their friends and family about the work of the entire care team to other members of your team. Remember to be a thoughtful communicator, because dialogue can help to shape ideas, plans of care and treatment options for patients. Relationships are at the heart of everything we do. My last section here is around the theme of mentorship and your role in that process. It is important to step back periodically on what you're doing to get clear on what it is you're doing. That applies now during your studies, on your placements, and especially when you're on the job practicing on your NMC license. Midwives and nurses are incredible doers. We love to do things, but unless we make a conscious note to step back and reflect with ourselves and our mentors, which frankly, I don't think we automatically do, then we won't look at what we're doing, look at our practice and how things are working. I need to do those things, and I know you do too. It is important for us to do this more systematically. There's great complexity in our work and always a lot going on. So how do we get our heads around some of the things that are challenging us in the clinical environment today? My best answer for you is with mentors, not the ones assigned to you on placements, but the ones you seek out. When you graduate, you'll land at the bottom of the totem pole, and that's a really good thing because it means you're highly mentorable. So I recommend reaching out to a combination of, say, 3 alumni from your course and or registered midwife or nurse leaders in the NHS who inspire you. Say something like this to them in an email. Hi, so-and-so, I recently graduated from KCL and admire what you've done as something or other. Then list something short and specific about them. As someone who loved KCL and was involved with some mutual extracurricular activity, I was hoping to get your advice as I enter the NHS as a registered midwife or nurse. Then ask if you can have 10 to 15 minutes to chat. I always think it's best to mention a time limit so they know you'll respect their busy schedule and you should always end on a question so they know what to respond to. That email template has served me very well, and I hope it works for you too. Obviously, modify it a little to suit your style, because that really awesome mental health practitioner embarking might get a little suspicious of a deluge of identical requests for mentorship. Keep the email short too. During the course of your studies, I bet you met some really inspirational pediatric nurse managers or midwife practitioners who you thought, I want to be like this person. They inspire me to be the best person and professional I can be. Those are the types of people you want as your mentors, even if they work somewhere different to where you'll end up working when you graduate. Once you find your mentors and start to build relationships with them, it's important to talk to them about real matters. I've talked to my various mentors about broadening my perspective on the scope of what I can accomplish as a registered nurse in direct inpatient care, helping me to understand the nuances of complex organizational dynamics, analyzing my mistakes such as medication administration errors, tips on how to do my job more efficiently, and advice on career path development. Tell your mentors what's on your mind and about how you are thinking about those things. By doing that with more experienced professionals, they can help you to shape your thinking so you can get to a place where you have a higher understanding of what's happening in your work. As a mentor, I find it so helpful when my mentees give me an agenda so I can plan ahead. I know that you'll see what a valuable asset a mentor can be to your continued success. Together, we will be victorious trailblazers for midwifery and nursing and those for whom we care, both in the UK and on the international stage, by upholding the standards of conduct, performance, and ethics in our professions day in and day out. Graduation from King's College London marks a new beginning as you transition into the next phase of your lives. My last tidbit for you is to take a break, treat yourself, connect with family and friends, then stay calm and carry on in the Florence Nightingale Faculty of Nursing, Midwifery and Palliative Care way. Thanks, everyone. I'll leave my contact details in the comment section below so you can connect with me. Next up is Jason Potts. Over to you, Jason.
Thanks, David. I really enjoyed the section on mentorship. It's been something that personally I have found to be invaluable while I've gone about my career. So yes, I'm Jason. I'm the lead emergency department research nurse for Barts Health. I actually trained to be a nurse in Leeds University and qualified in 2006. And then later in my career, I did a master's at King's, and I'll tell you how I got to that in a minute. I'm going to tell you what I think are the important pointers that will help you in the early stages of your career. And it might sound a little bit odd, so bear with me. I think patience is important, taking opportunities and delivering on those opportunities that you take up. And I'm going to explain why. Settling into the role of a nurse is quite different from being a student, but mostly it's adapting to the decisions to make what role you're going to take and where you are going to nurse. It takes a while to know what kind of nurse you're going to be, and it takes a while to best apply yourself in your new role. Be patient, give yourself time to perfect your skills and to improve your knowledge in the areas that you choose to start your career. Don't expect that you'll suddenly be able to carry out all of the new clinical skills that you didn't get to do as a student. I was really keen to learn those new skills straight off the bat when I got my first role, and was a little bit frustrated that I had to wait and kind of satisfy core competencies. But it's important that we become competent in what we know, and our managers also are looking out for our best interests when they say to us, yes, you can do them, but we're going to make you wait a little while before we register you for that course on cannulation, or before we send you on the catheterization course or the ECG interpretation course, or whatever it might be. You need to make sure that when you think that you can do a skill, that you can actually do it, and your managers also want to help you do that as well. You'll be aware that the NHS environment is pretty challenging at the moment for nurses. It's definitely more challenging now than when I qualified, but there's always been one challenge or another facing nurses. Again, be patient, don't panic, don't lose faith. in your career path. It's when things are getting difficult, this is the time to kind of just take a breath, think about what's important to you about what you do, and apply yourself to it. You want to be a good nurse who gives good care and makes a difference in the patient's lives. And you know, the NHS is always going to have challenges. It's a massive, massive organisation, and whatever happens over the next 10, 20, 30 years will happen. But you will still be responsible for your practice as a nurse, and you need to believe in yourself and do the best job that you can do. While you're settling into being a nurse and after you qualify, give yourself time to understand where you want to be. Career goals are different for everyone. Everyone's life goals vary. You might want to be a nurse because it gives you flexibility to look after children, or you might want to be a nurse because it gives you opportunities to travel if you can bring gaps of annual leave together, or even that you might want to travel and nurse overseas. But remember that whatever role you decide to do, that role is specific to you, and the reasons that you want to nurse are your reasons. And you need to respect the fact that all other nurses around you will also have different reasons, and they might not behave the same way you do. And so we need to be patient with them when they maybe do something different to us, because we've all got our own way of working. You might decide that critical care is your calling, like I did, and you might want to be where the drama is in acute care, like I did, and wanted to be in the A&E department. Whatever you decide, there's not really any bad first posts, and at a minimum you will learn what specialisms or generalism is for you, and all nursing roles have transferable skills. If you're undecided, find a job that has a bit of everything. There are rotational posts out there, and those will give you a bit of theatres, a bit of ICU, a bit of acute ward, a bit of emergency medicine. But I found, for me personally, I actually did my first 18 months on an acute care of elderly ward, which also included a acute stroke ward, or a hyperacute stroke ward as they are now. It was a mixture of everything. I got to see acute and chronic management of conditions. So diabetes, tissue viability, sepsis, acute stroke, rehab, and everything in between. You'll see enough in those kind of general posts to decide what it is that is interesting to you and where you think that you might want to apply yourself. Once I was there, I always knew that I wanted to work in A&E, not because it was on the telly or anything like that, but I just really liked the idea of a revolving door of new things coming in and having to apply myself. So when I had kind of passed my preceptorship and was settled into the role, I did some bank shifts in the emergency department where I still work, actually. And I learned a little bit about what it was to work in an A&E department. And that was one of the opportunities that I took. And I'll talk more about taking opportunities now. As you progress, managers are going to offer you opportunities to take on a role, maybe the lead role for tissue viability on the ward, and so you'll do some teaching and training to support that role. You might become the fire marshal or whatever the different roles in the area you work in are, and you'll be expected to deliver on those roles. And roles and opportunities come with perks. There'll be maybe a training course, there'll be a day away, there'll be time out of your usual role to go and work with people. Make sure you choose the opportunities that keep you going in the direction that you're interested in. If you have no interest in becoming a tissue viability nurse, then don't volunteer for that role. As you progress, the link nurse roles will start to offer you more opportunities and give you opportunities to differentiate yourself from your peers. And if you've chosen the right opportunities, they're going to be the staircases that kind of allow your career to move up and move on. So when you're further into your career and you're no longer a student nurse, you hopefully should have a good amount of time to make your non-working life as fun and interesting as possible. We've talked about the stressful environment that is the NHS, and also, actually being a nurse can be stressful. We'll see things that other people in other careers won't have to deal with. You need to make that work-life balance a real balance. You need to have fun and happiness in both sides, in your career and in your home life or in your personal life. So take opportunities to travel if that's your thing, or take up a sport, or join a group of people, or go to church, or whatever your thing is, and then apply yourself to that as well as that you would apply yourself to your career. Because when times are tough in work, you need to know why you're doing it. You're doing it because you've got all these things that you do in your home life, and you need to fund that, and that's why we work sometimes, is for the money. And sometimes if you've got a bit of stress at home, going to work can be a nice relief because it takes us out of that stress. So make sure you have that balance. So I'm going to talk about the opportunities that I took. So we talked about me working in care of elderly. I got my foundation skills. I did a cannulation course, and then I did my IV training. Then once I did that, I'd taken those opportunities. I could then go and do ED bank shifts in the A&E department. I built some relationships there, and after a little while of working there, they invited me to apply for a post as a staff nurse in the department, which I did. And actually having those relationships with those people, and them knowing me and having seen me work, made me feel much more confident when I went for those interviews, because they invited me there. They invited me to apply. So I felt like it wasn't a shot in the dark applying. In the A&E, I completed my core competencies. I went on the development course. I was a stroke link course, building on my prior knowledge from my earlier role. I developed a pathway with a consultant and the consultant nurse. I audited that pathway, and I presented that pathway at a national conference. That presentation gave me an opportunity, because it showed me, it showed to my peers and colleagues in the department that I had an ability to see something through. I could take an opportunity, I could make changes happen, I could look at those changes, see if they're effective, and then I could present it and promote my department. On, the next role that I was offered was a research nurse role, the first research nurse role in IA&E. And from there, I built a team. I grew in my own abilities, and I took the Masters at King's, and then I grew the team again, and opportunities kept on going and going and going. So take those opportunities, but when it comes to those opportunities, you need to make sure that you deliver on them. When you take a responsibility, whatever it is, people expect that you are going to deliver on that, and they don't want to be let down. People want to see that you're trustworthy and capable and competent. And if they see that, people trust you and they'll believe in you. And when people believe in you, then they give you more opportunities, and the career that you want or dream about will happen, because you'll be the safe pair of hands that can handle the responsibilities, can take those next steps, can support that team of people through whatever they're going through. Or you can, make your own team. I think mentorship as part of all of this is really, really important. And I hadn't really thought about including this in my talk until David mentioned it. But seeing people who have tread the path that you want to follow and asking them how they did it takes a lot of the sting out of the learning path to get there. I've got a mentor, and it's very informal, and when I see them, I chat to them about any kind of challenges or difficult things I'm thinking about with my career, and they kind of give me some advice, and then I go away and follow it. And it makes my life so much easier, because they knew the mistakes that they maybe might have made, or things that didn't work for them, and they've kind of steered me away from them. So the mentorship opportunities that have been offered to you through King's are really, really quite valuable. So if you'd like to talk to me, you'll find me through the mentorship program, and I'm more than happy to answer emails or take calls or whatever it might be that you feel you need. Thanks.
Hi, we have now come to the end of our video, And wouldn't you agree that there are some invaluable points for us to think about? I'd like to thank our speakers, David and Jason, and remind you that you can connect with them or find a mentor on King's Connect. Link to King's Connect in the video description below. We have our second video coming up on March 27th, featuring Professor Anne-Marie Rafferty, and she will talk us through her career as she progressed in the nursing field. Thank you for joining this video, provided to you by the Florence Nightingale Mentoring Programme, and stay tuned for more videos. Bye then.